Dr. McCollum, what about lactic acid?
So there was recently a good lively debate about lactic acids and whether that was helpful, because I'm sure many of you guys have seen lactic acid levels of like 7 or so on a lot of folks that come in with trauma. You're like, well, they're not septic. That's not why they caused their car crash. Does that mean anything? Do you want to comment on this, Jed, or you want me to just go with it?
It kind of depends, again, on what they look like. Lactate is commonly elevated in trauma. It also clears fast and a lot of times has no long-term repercussions at all. Just workouts. If you go after a strenuous workout, I'd kind of like to just go get blood work. I'm sure a lot of times my lactate would put me in septic levels, but it's no big deal. It clears in an hour, whatever. So again, kind of old, sick, actual wreck, then yes, I like it. I think it's a good screen. But unless they look sick otherwise, I think the lactate's just going to be a confuser because it's hard to discharge a lactate at 10 with no other symptoms on a dude that looks fine.
And that kind of elevated lactate would encourage you to either duplicate it or to dig deeper. Why do they have a lactate that's higher than 6 or 7? Like that is a significant predictor of mortality. And if you don't find anything, I would have a low threshold of repeating it if they look fantastic otherwise. It's not that every lactic acid bump requires admission, but you better have a darn good reason why you think that they're okay to go home.
So that was a big conclusion, right? That it still is a predictor of mortality even in trauma patients.
It is strongly associated with mortality in pretty much all patients, but specifically trauma patients. If you are traumatically injured, much of the time your lactate will go up. That does not mean that a low lactate means that you're not sick. There's plenty of people that are catastrophically injured and they haven't bumped their lactate yet. But most of those folks, if you actually go back and look, the people that have lactates of 9 and 10 usually were kind of sick, like something bad happened to them. And they're often the folks that end up being admitted anyway.
Do you think like 7-ish, if it's greater than that, definitely repeat it before you go and similar that home?
I don't have a firm line in the sand, but really over 5, like that's a big boy lactate. That's not kidding around.
Yeah, if you got a lactate, you can't send home septic levels. I mean, you got to get, I would probably go under 4 if I did have something in the chart that said it was high before I sent them back.
I think what you're saying here is that the lactates are very nonspecific. Is that,
Indeed.
am I, okay. So if you're getting a lot of lactates that are elevated in otherwise well-looking people, in a situation where there is literature saying that high lactates are highly predictive for bad outcomes in trauma patients, that sounds like an easy study for somebody in our group to do. Take a look at patients that look great and have high lactates and follow them. If there is a magic number above which you're more likely to get true pathology, that's worth something. But I think the problem you got here is that we're basically saying two different things. That it's a non-specific finding, but it also is highly predictive for badness. That's sort of a contradiction in terms.
And I would compare it to like the thinking man's white count. So we often talk about appendicitis and how the white count does not rule in or rule out appendicitis, which is totally true. But you're an idiot if you get a guy's white count and you find out that it's 32,000 and you say, well, I'm just going to discharge him. It's probably the flu. Like, you probably are going to dig a little bit deeper. That's not saying that every person with a white count of 32,000 is completely undischargeable, but you're probably going to give that guy a second look. Like, you're going to dig a little bit deeper and not just say, oh, it's the flu and they have a white count of 40,000 and I don't care. That's not that the performance of white counts very good. The performance of lactate's actually dramatically superior to white counts. But you have to take it in clinical context. So if they look fantastic, you might repeat a lactate. If it's trending down, I've discharged plenty of people that came in with a high lactate and then it trended down on a repeat 3 hours later after all their studies were done. But you wouldn't want to see it trending up. Like, that might be grounds for admission.
The makings of a study in there for a resident that would be interested in something like that. It'd be relatively simple to do. You pick well-looking people that have high lactates and see what happens to them over time.